My name is Anastasia Palmisano. I'm the owner and founder of MBA Holistics and Jessilove.org. MBA Holistics has a program that allows for seniors, chronic pain sufferers, and hospice patients to access the Maryland medical cannabis program, and also to have a medically supervised alternative healthcare program all in one. So we go to the facility or to the home and we have the medical evaluation, we do informational sessions, and all of that is handled by our medical director, Dr. Patricia Fry. The MMCC program, the largest percentage of patients that are accessing it are 55 and older, which is fantastic. Unfortunately, the patients that need the medication the most are chronically ill, hospice, palliative care patients. They are not accessing the program, and that's shown by the numbers that continue to grow a little bit, but not where we need them to be. So what we're seeing is people with significant muscular degenerative disease such as Parkinson's, MS, Lou Gehrig's, and also cancer patients using medical cannabis as symptom relief, and in some cases some people are using it to treat their cancer. One of MBA's missions is not only to educate patients, but the providers. So it all starts with providers, and a lot of the traditional medical providers are not comfortable with medical cannabis. There's not a handbook, there's not necessarily a lot of information, and if there is, it can be overwhelming outside of their regular practice to learn a whole nother pharmaceutical sort of concept. So that's one of the issues. We need to educate the providers so that they're comfortable enough to send their patients to a physician such as Dr. Fry, who has the knowledge base, who has the clinical and is involved in studies and all of the updated information, so that the original physician that sends their patient to a medical cannabis physician has that comfort. From that point, Dr. Fry, myself, and our team goes out and educates the providers, caretakers at facilities. They have to be aware of both what we're looking for in terms of relief and what we're looking for in terms of if this isn't the right fit, because it's not going to be the right fit for everyone. So we believe educating providers is just as important as educating the patients themselves. So on our website, mbaholistics.com, you can leave us a message, you can call me directly. We set up informational sessions with myself, Dr. Fry, and other members of our team for the providers, as well as go in and educate the patients so that they're comfortable and understand how medical cannabis can work alone with symptoms, can work with traditional medications. And so, and if they're interested in that program, we walk them through the online process to become first certified and then registered. So Dr. Fry will come back and do the evaluation at their facility so that it's really as easy and stress-free as possible. Because when people are sick, the last thing that they want or need is another having to go to a doctor, having to pick up a prescription. So another component to our program is if a patient is deemed appropriate for this program and they become registered, we have a delivery mechanism so that they don't have to go out and try to figure this stuff out on their own. So we handle that. Our doctor then follows up, makes sure they're progressing well. If there's any changes or tweaks in dosage or strains or any of those issues, that's handled, and then we move forward.